Hello, my little zebras. I want to talk today about stretching when you have hypermobile joints, like in HEDS and HSD. I've been getting a lot of questions about this lately, so I want to clear the air. So, for the general population, flexibility is often seen as one of the main component mainstays of overall wellness and health and physical ability. That is still true. Now, if you label yourself as a zebra with hEDS, HSD, or just know that you are a very mobile person in general, you don't need to worry about the flexibility as much. So in general, I don't prescribe static stretching to a lot of hypermobile people. Now, if you know me, you know I hate blanket statements. Blanket statements of always do this exercise, never do this exercise. I will not say that to people because there's always an exception, and it's really hard with any person, regardless of diagnosis or population or body type, to provide an all or none sort of statement like that. There's always exceptions to the rule, and there's always a lot of contingencies. So let's get started and dive into this. So with hypermobile joints, it is not uncommon to feel sensations of tightness. This is because your muscles are becoming your new primary stabilizing force to those loose joints, since the collagen and the ligaments are not doing what we would like them to do. So those muscles go into that good supportive position around whatever joint you choose. And if that joint is particularly loose, that muscle can go into a tight spasm. It's guarding, it's protecting, right? It is trying to keep you stable. This feels uncomfortable because a spasmodic muscle is uncomfortable and it does feel tight. So those sensations are entirely real, but it's not really giving your brain and your body the whole story. When we release that muscle via stretching or by doing a trigger point release, so that's finding that tight muscle, applying pressure, letting it let go. But if we don't strengthen after that release or that stretch, you start moving around, that joint feels loose again. That muscle goes back into that spasmodic guarding position, and that sensation perpetuates. So that's not great. Ideally, when we have these tight muscles, we want to release them, but then we want to strengthen them so that then it can provide appropriate support to those joints. So you never want to release or stretch a muscle without also strengthening it, especially in hEDS or HSD. Okay. My rule of thumb, I don't do a whole lot of static stretching. So that is, taking your joint to the end range of motion and pulling and holding. It's not fantastic. We don't need to do it a lot of the times. Do I do it some of the times? Sure. I just joined a new rock climbing gym in my new town here. My forearms are burning up. So I am doing a little bit of this. That being said, I am not cranking at 100%. I'm going until I feel a gentle 25 to 50% stretch, just enough to kind of let that muscle fall out of the cramping sensation that I've been having. But I am not doing it for more than 30 seconds. I'm not doing it all day long. It's just occasionally after I had a long climb, my body's not adapted to it. I feel like I need to kind of get it to calm down. My preferred mechanisms for tight muscles are to, one, do a foam roll. That's usually a really good go-to, whether it's the spine, whether it's the lower legs, a little bit harder to do on your upper extremities, but you roll around, you find that tight spot, and you sink into it a little bit. This helps to provide that trigger point release and a little bit of massage, but then it saves our hands, which is always a good thing. I also started a new job recently, and I am looking down at a tablet all day long. My lower neck and upper thoracic spine have been killing me because I've just had lousy posture trying to learn this stupid new tablet for documentation. So I've been doing a quick foam roll before bed, just trying to get a little bit of extension back into that space. In which case, those joints are popping like Rice Krispie treats. That's not alarming to me. It usually feels pretty good, darn good. I'm going to loop back to the joints popping in a minute here. But either way, there's other ways to get muscles and joints to feel better without doing a full amount of cranking on that static stretching. Dynamic stretching can also be really beneficial. For instance, I'll do this before I go for a walk or for a jog. Dynamic stretching is moving the muscle through the whole range of motion in and out, more or less, right? So if I'm going for a walk or a jog, I'll stand and I'll hold on to something for balance, and then I'll do some hip swings to just kind of get those legs going through that range of motion. Or if I'm going to be doing any sort of weightlifting and squatting or just moving around in general, I'll do some air squats or air squats and forward folds, something that just kind of gently moves the body through that range of motion without a whole lot of resistance. That helps to kind of warm the muscle up, makes it less likely to go into panic mode if you overload that tissue too much. Okay. I get a lot of questions about yoga. Should you do yoga if you have joint hypermobility or collagen deficits? I say it depends on your intention. If your intention is going into yoga to gain flexibility, no, you don't need to do that. That's what a lot of people love to do yoga for, but us hypermobile folks, we don't need that. We need more joint stability rather than loosey-goosey muscles. Now, I still do yoga, but I change my intention with it. So if I am going into down dog, I am more likely to try to pedal my heels in and out. So it gives a little bit more of a gentle stretch to the dura or the protective coating around the nerves, because I have a tendency for tightness there, and it can be perceived as hamstring tightness often. So I'll do a little bit of motion in that position. If I'm doing something like a warrior pose or a triangle pose, something where I'm out in a big lunge, instead of thinking about sinking into that stretch, I'm thinking about trying to shred the mat with my feet. So it gets more outer hip activation and more muscle engagement rather than stretching out that hip joint capsule. So I change my intention for it. I still get mindful movement in my day paired with breath, which is good for calming down the centralized nervous system, which is great for a painful day or an anxious day. I also get a little bit of muscle engagement and stability, strength in varying positions. So I do love yoga, but again, I'm changing my intention. Even if the yoga instructor is providing XYZ instructions, I'm still just tweaking it a little bit in my head so that it benefits me the most. Okay, so static stretching, okay sometimes, not preferred all of the times. If you're going to do it at not a full stretch. A lot of muscles will give you that rebound tightness if you overstretch them. Neck muscles in particular, hypermobile or not, neck muscles are really, really particular. And if you're like me, you've had those days where you've turned your head so quickly that these muscles go into a guarding position. For things like that, what I'll do is, let's say it's on this side of my neck, I'll shorten that tissue a little bit by bending into the same side. I'll do a pinch or a push on a muscle depending on where it's at to try to do a release. And then I do some gentle strengthening. The idea here is that you're getting that muscle to contract a little bit and relax a little bit, and contract a little bit and relax a little bit. So it lets it kind of ease out of that spasm or that icky feeling. So in the case of the neck pain or spasm, I'm putting my fingers up against my head and I'm thinking about tilting over this way, but maybe I'm not really moving that far. And I'm not pushing hard. It's 1 or 2 fingertips and just a little bit of pressure. Activate that muscle. You might feel it a little bit and then back off a little bit. And then push into that muscle and then relax. I know that I have a really strong benefit here as a PT because I know my muscles left, right, and center here. I start to feel a feel coming on and I know how to nip it in the bud. Not everyone has that luxury, and I know that. That's why I'm trying to help out with some of these videos. But Moral of the story is trial and error. Let's say it's a neck muscle and you're saying, well, this isn't quite getting it. Try throwing some rotation into it. Try throwing some extension into it. See if that changes the angle of the pull. And when you get to, oh yeah, that's kind of where it's at, you found it. It's trial and error. I still have to do that sometimes on my own body, just because even if I know the anatomy really well, sometimes the feelings don't always perceive like what I would anticipate. All right, I want to back up the bus a little bit to some joint cracking. A lot of people ask me about the joint popping as well. For the most part, joint popping is not alarming. A dislocation is. If you dislocate your shoulder, that's a big deal. This is not what we're talking about. We're talking about like cracking your knuckles, right? Or you go to stand up and your hip pops or your knee pops. That doesn't alarm me a whole lot. We know that when we are static for a while and not moving, we can get some increased fluid in those joints. And then when we move the joint space, it can compress that fluid. It creates a gas. That's what causes that popping sound. Okay. Most of the time, when it's a patient, when it's me, I'm not really alarmed about it. But as hypermobile jointed people, I usually say, don't seek it out. Okay. Here's my personal example. At one point while I was in PT school, I learned how to pop my SI joint. So right in the back of the pelvis. Okay. It felt amazing because it does. It releases endorphins. There's a reason people love to crack their joints. Okay. So I was sitting in class for 8 to 9 hours a day. Sitting doesn't feel great on SI joints because they love motion. I learned how to pop it. We call it the shotgun method in PT school. I learned how to do that. And so I would do it, 3/4 of the way through my day of sitting in class. And I would do it and it would feel great. And then I'd carry on. Then I was doing it twice a day. Then I was doing it 3 times a day. Then I was doing it every hour of class. And guess what? It increased pain in my SI joint when I was up and moving around and doing my usual stuff. So it was creating more mobility in that area when I was not strengthening it. So I now call myself a reformed crack addict because I no longer do that. Every once in a while, sure, it might be indicated, but it's once every 3 years if I sit in a really long course over the weekend and I'm in a twisted position. But for the most part, I helped to resolve that pain that started settling in there by working on pelvic girdle strengthening. And this is before I became a pelvic floor therapist, so I was kind of trying to just put some pieces together here. But my go-to, tried and true for so many people and for myself, is doing bridges. So I started doing bridges to activate my glutes, which provides support to the SI joint. And I stopped having that pain while sitting. And I didn't feel the need to crack that joint anymore. So, moral of the story is, if they pop as you're moving, probably not a big deal, unless it's dislocation. But if you are intentionally seeking out routinely popping a joint, especially if it's on a daily basis, I want you to look at why you're doing that. Maybe it's because there is an inflammatory, icky pain that's settling in that your body feels like you need to try to get rid of. So that could be that you need to move a little bit more in a certain way. It could mean that you need to strengthen a certain set of muscles. There's a lot of pieces to the puzzle on this one. But a lot of people are always panicking about popping joints. Don't panic. It's not the end of the world. My hips are notorious for popping when I just sneeze. They're my problem joints. They're always making noise, always moving around. They'll start to feel tight, and all it takes is for me to twist and look over my shoulder and they pop and I feel better, right? But I'm not seeking it out quite so much. It just occurs throughout my day as I move around. So, moral of the story is, there's no one blanket statement for absolutely do this, absolutely do not do this. But I'm going to caution you, if you are doing any sort of static stretch, make sure you're doing something to activate or strengthen that muscle following that. Same rules apply if you are going to do any sort of foam rolling, any sort of trigger point release, anything like that. The other moral of the story is, a tight muscle does not mean it's a strong muscle. It just means it's spasmodic. My own personal soapbox on this is hip flexors. right in the front hip crease, right? Helps to bend our hip. These muscles are tight in everybody that I see. And the go-to is to try to do a ton of stretching, whether it's in a lunge stretch, whether it's in the half kneel stretch. People are always stretching the dickens out of their hip flexors. But that doesn't mean that they're strong. Our psoas muscle crosses our hip joint, helps it to flex, but it also inserts on our lumbar spine, our lower spinal bones. So it provides vertical support to our spine, whereas our abdominals provide horizontal support to our spine. Pelvic floor provides inferior support. It all works together. So you can do a ton of abdominal exercises until the cows come home, but until you start incorporating some of that hip flexor strengthening, then you're not going to have that good spinal core support. I now give a ton of hip flexor strengthening exercises to a lot of my patients and clients, and all of a sudden their back pain starts to dissipate. All of a sudden that hip flexor tightness, they don't feel it anymore because it's no longer a weak muscle trying to hang on for dear life. It's a strong muscle that can move through the whole range of motion. So there's a lot of nuance to the body. When we add joint hypermobility, there's even more. But moral of the story is, don't just follow what you see online of saying, absolutely do this, absolutely don't do that. That's not the case for a lot of us. Or if it's, okay, yeah, we're going to do this, you want to change your intention just a little bit, like with yoga, right? So I hope that helps to clarify some questions that you might have about stretching with joint hypermobility. If not, throw a question in the comments or reach out and we'll see if we can find something that works best for you. Stay strong and bendy, zebras.